Hello, my name's Justine Munner. I'm a physiotherapist and acupuncturist and I work for Just Therapy. Today I'm going to talk to you about what acupuncture is. Acupuncture is obviously a huge topic, so we're going to break it down into bite-sized chunks with subsequent videos talking about things like how it works and what it can do for you. Acupuncture is the insertion of fine needles into points, varying locations all over the body. The needles are single use, very fine, ranging between 0.18 and roughly 0.3 millimeters wide, pre-sterilised needles, and once they're used they're thrown away into a sharps bin. So acupuncture shouldn't be painful. When the needle goes in, most people don't even feel the needle insertion because the needles are just so fine. The acupuncturist, once the needle's in, will guide that needle into the acupuncture point, and should, once hitting the point, should feel a slight change in resistance. This is where the needle hits the fascia layer. Once the needle's in position and the needle has been stimulated, a term I like to call twiddling, the patient should experience what we call dai chi. Now dai chi will vary from patient to patient, from needle to needle. It can feel like a tingly sensation, a warm sensation, a nummy sensation, a dull ache sensation. What it shouldn't feel like is a sharp needle sticking into you. Once the needle's in position, they're left for a varying amount of time. Depends what the acupuncturist is trying to get out of the treatment, but on the whole, the treatment lasts for about 20 minutes. It's generally a very relaxing experience, and quite often clients will have a little bit of a nap while they're having a treatment, and that's a good sign that it's doing its job. So how do we decide which points we're going to put into each patient? Most acupuncturists will clinically reason their point selection using a Chinese medicine approach. This is very different to a Western medicine or a biomedical approach. To most people, if I started talking about trying to balance your yin or yang, trying to remove stagnation out of your system, or trying to clear winds, you'd probably think I was a little bit strange. However, once you start understanding and learning about Chinese medicine, you really quickly realise that it's a very, very clever approach looking at how to look at health. It's very much a holistic approach. It looks at the person as an individual, what's going on with that person, not just the symptom that they may be talking about at the time. Many healthcare professionals, such as physiotherapists, osteopaths, GPs, also use acupuncture as an adjunct to their own treatments. However, their clinical reasoning system will be different to a Chinese medicine one. The points themselves will be the same locations, but the way that they will reason the use of the points will be through the way that the needling affects the body locally, so in the skin and the superficial layers of the tissues, the muscles, how it affects and how it changes the responses at the spinal cord level, and how the brain reacts to acupuncture needling itself. This type of acupuncture works very well for muscular dysfunction and also pain problems. We can also use acupuncture needles to release what we call trigger points, what you might know as knots, so where you get tight muscles and there's real kind of trigger points that you want to just release off because they're causing a bit of stiffness and causing a bit of pain. Often the result of repetitive strain, postural problems or injury. This is actually called dry needling, and it doesn't use acupuncture points, it's simply putting the needle into the knot and releasing it. So hopefully that's explained a little bit to you about what acupuncture is. In subsequent videos, hopefully in the near future, we'll be talking about how acupuncture works, the science behind what happens in the brain, what happens at the needle sites, how a knot gets released off.